Hello,
To introduce you.
can you hear me? Yeah.
Yes, look, I can hear you. Yeah,
Okay.
there.
So Audrey,
Mm.
you have to find someone.
Getting
Don't
there,
work
doc. Getting there.
too hard. Don't work too hard.
Doc.
Yeah. I'm glad, Nicole is thinking.
Oh, yeah. Okay. Okay. Good afternoon, doc. So actually, we just got online. So for the people watching us today, did you know that we observe World Diabetes Day every November 14? So kaya naman, this afternoon, we've invited the director for Retina Service to join us for Ask Your Asian Eye Doctor Facebook Live Q&A. So what Dr. Veloso will be talking about today is how diabetes can really affect the eyes. So nakakabulag nga ba ito at paano ba natin mapoprotektahan ang ating mga mata? So I'm Audrey and I'll be your host this afternoon. If you guys have questions, mag-comment lang kayo. We'll try to answer them after our discussion. But before anything else, let me introduce you to our featured doctor this afternoon, Dr. Amadeo Veloso Jr. So Dr. Veloso specializes in retina and vitreous disease, cataract, and comprehensive ophthalmology. He completed his medicine degree and medical internship at the University of the Philippines, Philippine General Hospital, and then underwent residency training in ophthalmology at St. Luke's Medical Center, where he became the chief resident. He then pursued clinical fellowship training in retina and vitreous disease at St. Luke's Medical Center and at the Shepard's Eye Research Institute at the Harvard Medical School in Massachusetts in the USA. He's also an active researcher, so he has had several pioneering research publications in both local and international journals. And he's a resource speaker in local and international conventions and conferences, and is also a founding member of the Vitreous Retina Society of the Philippines and the vice president and medical director of the Ophthalmological Foundation of the Philippines. Right now, he is the director of Asian Eyes Retina and Vitreous Disease Service and Asian Eyes Retina Fellowship Program. So good afternoon, Doc. How are you?
Good afternoon. Nice to be here, Audrey.
Okay, so actually earlier I think we've been talking a lot about how the pandemic has kind of changed the way things have gone, whether it's to do with how your family deals with things or even with how people treat their eye care. So specifically talk with diabetic retinopathy ba, it's a serious condition and the fact that we have a World Diabetes Day tells us na maraming nagsasuffer with this condition and people need to understand that there's really something that we can do about it. So when people say diabetic retinopathy, doc, ano bang part ng mata ang affected and what does it do to your eyes?
Well, diabetic retinopathy is a eye disease that affects the back of the eye. At the back there's a lining we call the retina, and this is the part of the eye that becomes affected by diabetes. So when a patient has diabetes, blood vessels and abnormal blood vessels can grow, merong hemorrhages and exudates or areas of swelling because the small blood vessels become leaky. They
Okay.
start to leak blood and the blood flow is not very efficient.
Okay. So, doc, essentially, like the major concern when you have retinopathy is that kung ano yung um, tuloy-tuloy na daloy ng dugo sa mata, yun yung nabablock. That's what the diabetes really affects. Too much sugar affects your vessels, so your vessels don't function the way they normally would. And then, Doc, you've told me before that there are really two types of diabetic retinopathy. Can you tell us a little bit more about the differences between the two?
Yeah, the two general types are the proliferative, which is the serious type of diabetic retinopathy, and the non-proliferative, which is the less serious type.
Mm-hmm.
If the patient has the non-proliferative type of retinopathy, we don't do anything except to advise the patient to strictly control their blood sugar. And we also tell them to come regularly for eye checkup and watch out for symptoms. The symptoms are blurring of vision, distortion, floaters. These are the things that we can do to help the patient with non-proliferative. With
Okay.
the proliferative type, abnormal blood vessels start to grow on the surface of the retina. And this can lead to complications that can be sight threatening, such as vitreous hemorrhage or bleeding,
Mm-hmm.
uh, traction retinal detachment. So membranes begin to form on the retina, and this can lead to blindness within a few weeks or a few months.
Okay. So, Doc, how about fluctuating vision? Is that also a possible sign that maybe there's something wrong with your retina?
Usually for diabetic patients, when the vision fluctuates, it's a sign that the blood sugar is also fluctuating.
Mm-hmm.
You know, some patients, they come in with several eyeglasses, and
Mm-hmm.
then they almost predict what their blood sugar is based on the eyeglasses. So
Okay.
this is the pair that I use when my sugar is low, and this is another pair that I use when my sugar is up. So
Okay.
fluctuating vision is not a good sign. It's a sign
Okay.
of poor control.
Okay. So I think that goes to show na kapag hindi mo talaga binabantayan yung sugar mo, it has a direct effect. In this case, nagbo-blur or nagki-clear yung vision mo depending on how well you control your blood sugar. So when you come in, for one thing, you as the doctor, you can tell kung meron talagang nagiging difference if they have poor control of their diabetes or if they have good control of it. Uh,
Yes.
Doc, if a person has diabetes, will they immediately get diabetic retinopathy?
No, the patient doesn't get the retinopathy right away. That's why there's really no excuse to to to
Mm-mm.
not get the retinopathy. It takes sometimes as long as 5 years
Mm-mm.
before diabetic retinopathy begins to be noticeable in the retina.
Mm-mm.
So early on, strict blood sugar control should be observed.
Okay. How about, Doc, if the patient has maybe high blood pressure or high cholesterol? Are these factors that can contribute to it?
Yes, hypertension and high cholesterol can contribute to retinopathy. There is such a thing as hypertensive retinopathy also, and sometimes they are present uh, at the same time with diabetic retinopathy. So it can be like
Mm.
two diseases in one.
Okay. Okay, so parang combined yung effects nun. So in that case, you're magiging mahalaga na ma-manage nila both the hypertension and the blood sugar levels.
That's right, and the cholesterol. They all work hand in hand.
Okay. And then, Doc, so what happens if they have poor control? Can a diabetic retinopathy actually lead to permanent blindness?
Oh yes, the sad thing with diabetic retinopathy is it usually affects the vision when it's already very severe. So many
Mhm.
patients don't even know they have retinopathy, and and it's a very serious sight threatening. It's a very serious condition that can lead to permanent loss of vision. So it's really important
Okay.
to uh, to get checked. No?
Okay. So, and so, Doc, aside from managing syempre yung diabetes mo, ano ba yung pwede mong gawin para ma-prevent yung diabetic retinopathy? You've mentioned already na dapat syempre bantayan mo yung blood sugar level, and of course, you keep your blood pressure and cholesterol in check. But what other ways do you have to preventing diabetic retinopathy?
Well, one of the best ways, but the most difficult, is to control the diet.
Mm-mm.
No? It's easy to say eat less, control the diet, but it's very difficult because most of the time, diabetics always feel hungry. Their
Mm,
body feels like they are not getting enough nutrition because a
okay,
lot of it really stays in the blood. So they keep eating and eating, and it exacerbates their uh,
their
their medical
condition.
condition. Yeah. So diabetic strict
Diet.
diet is important.
Okay. How about,
Exercise helps
okay,
also.
yes.
So if,
Uh-uh.
if you love to eat, then you can help burn the sugar by exercising.
Mm-mm. And then, Doc, how about other habits? For example, if the patient is also a smoker.
Smoking also affects the small blood vessels.
Mhm.
So you know, if you're diabetic and hypertensive, it's best to also cut smoking as early as possible. Yes.
Okay. So
Yeah.
essentially, Doc, parang yung kapag pinag-usapan natin diabetes, ibig sabihin nun yung buong katawan mo na kasi is affected in different ways. So that's why you're saying, parang lifestyle change siya, Doc. Hindi siya pwedeng basta, I'm gonna lessen sweets, let's say. Hindi ako kakain as much. In fact, as based dun sa sinasabi niyo, kailangan mag-exercise ka, you change your habits. Huwag ka na masyadong kumain ng siguro matataas na cholesterol na pagkain. You have to stop smoking because it affects the rest of your body, including pala your blood vessels. And then siguro, Doc, the tip that people need to understand is kapag meron ka ng diabetic retinopathy, kapag may pagbabago in your vision, kailangan mo na talaga siya ipacheck. Huwag mo na siyang hintayin.
Yes, oo. In fact, most of the time, nakikita natin na the vision is really very poor. And then when we examine the eye, we know na yung vision nila is really threatened.
Mm-mm.
So don't wait for the symptoms to appear. No,
Mm.
have yourself checked, even if your vision is still good.
Mm. Doc, does it ever happen to you that a patient comes to you, magpapa-check-up lang, a standard yearly checkup, and it ends up you being the one to tell the patient na actually, you know what, baka kailangan magpa-check for diabetes kasi based on your vision, mukhang affected na ang mata mo.
It's not really the vision, because it usually starts late. It's more
Mhm,
of the medical history. So
mhm,
sometimes we are able to extract that they've been diabetic for 10 years, and you can see that they're obese, no? And when you ask for more information, you pick up that the father had diabetes, the mother had an amputation,
mhm,
the uncle lost his vision, the sister is undergoing dialysis. So these are more important uh, findings that will tell you to probably examine the patient more for
mhm.
retinal. Yeah,
Okay. So, Doc,
yeah.
let's say you have a patient na hindi siya sigurado kung meron siyang retinopathy. What is the best way para malaman ng pasyente kung meron na ba siyang retinopathy?
The best is to do a dilated fundus exam. So it's best to go to a retina specialist and have yourself have your pupils dilated and inspected very well. There are
Okay.
also tests that we can do to confirm. No? Sometimes the retina may look normal, but it may still be abnormal.
Okay. So, Doc, when you say it has to be a checkup, you have to get a fundus photo. So, hindi siya basta-basta regular checkup. It has to be like a comprehensive eye exam talaga.
Yes, most of the time, if you just get the routine eye exam, they just check your grade, check your vision,
Mm-mm.
uh, look at the external part of the eye, but they don't really look inside. They
Mm-mm.
don't bother to inspect their retina. So this is really important.
Okay. So, yun siguro yung isang mahalagang tip na kapag may marami kasi tayong mga pasyente, iniisip nila na, okay, kailangan ko lang ng salamin or medyo blur lang yung vision. So, yung automatic na reaction is, hindi, sige, magpapasalamin ako. Yung hindi
Mhm.
nila alam is that kapag pagpapasalamin lang ang focus mo, hindi nga nila tinitingnan yung loob ng mata. And that's where the damage starts. And as you said, even before the vision is affected.
Mhm.
Um, Doc, you were talking about that there are different tests that can confirm whether a patient has retinopathy. Ano tong optical coherence tomography and the fluorescein angiography?
The basic test to determine how severe yung retinopathy is to do a fluorescein angiogram. It's a test where we inject a dye in the vein sa may kamay, and then
Mhm.
we take a series of photographs. And dito sa pictures na ito, we will be able to see kung merong leakage in the retina. And we are
Okay,
able to stage the retinopathy accurately. As I said, di ba, merong non-proliferative and proliferative stage. So this is the best way.
okay.
Yung optical coherence tomography or OCT scan, it only determines kung merong edema or
Mhm.
swelling in the macular area. So
Okay.
this is important because sometimes you can have severe retinopathy pero walang edema. And sometimes you can have edema or swelling in the macula even without very severe diabetic retinopathy. So these are the two areas that we monitor uh, for retinopathy.
Okay. And then,
Mhm.
Doc, let's say ang isang pasyente gusto niya magpa-schedule ng check-up with you, ano yung kailangan nilang i-prepare before they come in for a check-up?
Well, if they have recent blood exams, especially yung FBS and HbA1c, that would be good. They should list down the medications that they're on, that they're taking, so that we can see kung diabetic sila. Sometimes, they don't admit that they're diabetic, but then when you ask them about their daily maintenance medication, doon lumalabas.
Hmm,
Uh,
okay.
doing a checking on the family history plays a big role in the diagnosis of retinopathy, diabetic retinopathy.
Mm. So, in that case, doc, it's very important actually na to be very honest with your doctor. Kasi that's the best way for you to really determine ano bang other tests you need to be doing to make sure that they get an accurate diagnosis.
Yes.
Hmm. And then siguro for our viewers today, kung meron kayong mga katanungan for Dr. Veloso about retinopathy or other problems in the eye related to diabetes, you can just send it in the comments below and we will actually get to them during the discussion. And then siguro doc, speaking of being able to detect and manage diabetes and retinopathy, what happens ba doc if we don't have it diagnosed and it's not managed by a doctor? Ano ba yung pwedeng mangyari sa mata?
Well, oftentimes the patient will come in dahil meron ng bleeding, so they can't see anymore. And
Mm,
sometimes, yung isang mata nila is already almost blind, and for several months or years they were relying only on one eye. And when they
ah,
come in, you can see na yung kanilang only eye is severely affected, and the fellow eye, the other eye, is almost blind. So that's what we normally encounter. Uh, I think there's a lot of denial sometimes among diabetic patients. They,
ayaw pa nilang i-admit na meron pala talagang problema.
uh, yes.
Do you think, Doc, na siguro lalo na during the time of the pandemic, a lot of people kasi, ang nagiging reaction, syempre, or their coping mechanism is really through food, trying to comfort themselves with stress eating. Do you think or do you find na siguro in the past year, you have been getting more patients that baka dati medyo manageable naman yung diabetes, but over time, during the pandemic, it's become more of a challenge?
Well, yes, because people are going out less. They're
Mm-mm.
able, they're not able to exercise as much, and at home, it's so easy to eat. No, just open the
Mm.
fridge and you can grab a bite. And especially now, where you can order online and
Yeah.
you can get any food practically
Mhm.
delivered at any time of the day. So,
Yeah.
yung pandemic has somehow affected the control ng mga blood sugar control ng mga diabetics.
Okay. And then,
That's
Doc, mm. So, Doc, in that case, siguro over the pandemic, let's say they already had a fairly serious eye condition, specifically with retinopathy. Um, how about developing something like in diabetic macular edema? What happens if you actually develop that as part of your retinopathy condition?
well, when a patient has diabetic macular edema, these are the patients that complain of blurry vision.
Mm,
So most of the time, they would need, if it's not too serious, just medication and sugar control. But sometimes they may need laser or even injections. We give injections in the eye to help control the swelling.
okay. How about, Doc, when it comes to neovascular glaucoma?
Neovascular glaucoma is a very severe complication of uncontrolled diabetic retinopathy. So this is a condition where the eye pressure goes up because
Mm-hmm.
the abnormal blood vessels from the retina, they begin to migrate, they move up and clog the drainage system in the eye. So this causes the pressure
Ah,
to go up. Uh,
okay.
it's very hard to manage neovascular glaucoma because most of the time this is the end stage of the disease. This is the stage which can lead to permanent loss of vision.
Mm. So in essence, Doc, ito yung gusto nating iwasan. We don't want a patient na makarating sa punto na neovascular glaucoma na yung condition niya.
Yes, in fact, there are a lot of things that we can do to prevent neovascular glaucoma.
Mm.
Only if they had come in earlier and
Okay.
and their eyes managed also soon enough.
Mm. How about, Doc, when it comes to retinal detachment naman?
One of the complications of diabetic retinopathy is a condition called traction retinal detachment. This is a condition where uh, membranes form over the retina, and these
Mhm.
membranes begin to pull up the retina. So it's not caused by a break, which is most often we associate with retinal detachment. This is the tractional
Mm.
type. That means there's pulling of the macula and the retina because of the formation of membranes. Usually,
Okay.
usually when it reaches this stage, the eye becomes a surgical case already.
I
Yeah.
see, okay.
There's
Kasi,
a
Doc,
linear operation.
oo. I've heard you talk about yung retinal detachment before. Typically, it comes as, pag minsan na-aksidente ka, you get punched in the face, pag minsan nagde-detach. Kasi literally, that's why parang yung pakiramdam mo is like, merong kurtina ang nahulog in front of your eyes. That's why you can't see. So in this case, kapag sinasabi niyong retinal detachment na related sa diabetic retinopathy, it's more like a slow growth. It's traction. Unti-unti siyang nagde-develop over time habang hindi mo nababantayan yung kondisyon ng mata.
That's right.
Um,
Yes.
mm. So, Doc, we already know that yung diabetes naman is a lifelong condition. So, how often would you recommend ang isang pasyente to undergo yung comprehensive eye exam? And required ba lagi na mag-undergo siya ng mga diagnostic test na binanggit mo kanina?
Lahat ng diabetics, whether in good control or hindi, have to be checked. As I said earlier, yung dilated exam every
Mm.
6 months. Kahit wala silang nararamdaman, even if their vision is good, routine yun every 6 months. And we report the findings to their endocrinologists.
Mm.
Kasi yung mga endocrinologists, they also are aware that diabetes is a very sight-threatening, can lead to a sight-threatening condition.
Okay. And then, Doc, siguro, when you're talking about sight threatening, let's say meron silang nararamdaman or nataon na meron silang diabetic retinopathy at may naramdaman silang konting change sa vision, pwede ba silang mag-consult sa'yo through teleconsultation?
It's hard to diagnose retinopathy just online. The
Mhm.
best is to come to the clinic, set an appointment, give yourself time kasi medyo matagal yung dilated exam eh. And
Mm.
sometimes we may have to do the tests that you mentioned a while ago, yung fluorescein angiogram and the OCT scan.
Okay.
Unfortunately, there's no shortcut when it comes to the diagnosis and treatment of retinopathy.
I see. Okay. So siguro yun yung tip for people. So the two things that Doc mentioned is that yung una, every 6 months, magpa-check up na tayo. Kasi di naman natin alam kung talaga magde-develop ka ng retinopathy or not. And the second thing is that as much as gusto nating makuha sa teleconsultation, sa simple phone call or video call with the doctor, mahalaga talaga that we're able to do the test para malaman talaga natin kung ano yung naging epekto na sa mata ninyo.
Yeah.
So, at least on the upside, alam mo na, pwede mo siyang paghandaan, pwede mo siyang i-schedule in advance. Siguro, one tip that I've learned from some patients, ang ginagawa nila, they make sure they have a check-up around the time near their birthday. Para
Mhm.
basta't magbo-birthday sila, kailangan magpapa-check up sila. And then I guess whatever 6 months is after that. So meron kayong guide, meron kayong reference lagi. So if your doctor or your endocrinologist, i-check nila yung records mo, it's always along those times of the year. Okay.
That's right. Yeah, that's a good guide. Yeah.
Mm. And then, Doc, here, we actually have a couple of questions from our viewers today. So the first question is, sino ang pwede magkaroon ng type 1 and type 2 na diabetes?
Sorry. Sino ang pwede?
Yes, Doc, na magkaroon ng type 1 and type 2 na diabetes who are likely to develop these conditions.
Usually yung type 1, ito yung mga diabetics na that belong to the younger set.
Mhm.
That means usually diabetes starts before the age of 35. While yung type 2, ito yung usually hindi insulin requiring, and this happens at an older age group.
Mm.
Now,
Doc,
yung
does that mean yung
uh,
type 2, yun yung mga na-develop nila over time? It could be as a result of environmental factors as well as their lifestyle, kaya sila nag-develop ng diabetes.
yes, but it's important to know na yung mga type 1 or the insulin dependent diabetic patients are more inclined to develop yung severe forms of diabetic retinopathy. No?
Mm,
So importante malaman nila yon. No? So we
mm,
see a lot of young people in their 30s and 40s that have very severe stages of retinopathy. While there are 70 and 80-year-olds na matagal na silang diabetic, but yung damage to the retina is not as severe as the type 1 diabetics.
I see. So, Doc, part of it siguro is also a function of how much longer they have had it.
Yes, that's one.
Mhm,
And mas poorly controlled and mahirap i-manage yung type 1 kaysa sa type 2.
I
So
see. Okay.
that's another factor also.
Mm. So kaya't mahalaga talaga yung, constant monitoring. Kasi minsan nga, I think I understand that, Doc, eh. One of the reasons it's so hard to monitor blood sugar and all these things is that it's easy to forget or it's easy to set it aside. Na parang, oh, you just wanna kind of feel comfort through food or you wanna be able to enjoy time with friends or family. Pero if you actually mag-schedule ka, alam mo in 3 months siguro, scheduled ako para makita ko yung doctor ko. Minsan, minamanage mo yung sarili mo a little bit better because you're
Mhm.
also preparing for that checkup. So at least, if you set that up sa lifestyle mo, there's a little bit more management that's done. And in a way, your doctor becomes your guide.
That's right. Yes.
Mm-mm. And
Yeah.
then, Doc, here, I think this is an interesting question. Someone's asking, may activities bang bawal for people with diabetic retinopathy?
Well, wala naman, except
Mhm,
of course if you're in a profession na
mhm,
yung you need to have very good eyesight. Let's
mhm,
say you're a pilot, di
mhm,
ba? And you have to have very good eyesight. Of course, you cannot perform those kinds of activities.
mhm.
So depende yun sa profession ng patient.
Oo. And siguro thinking about it, Doc, siguro if your certain hobbies may not be the
Is
best for you. For example, it's very popular these days online yung to watch people eat, yung mga mukbang. They order a lot of food and and you have people watch you eat like loads of food online. Something like that will probably not be a good idea kapag meron kang diabetic retinopathy.
well, whether or not merong mukbang, uh,
Mm-mm,
we have to tell ourselves that we should control our eating, di ba?
mm-mm,
Yeah.
mm-mm,
So
that's
so
right.
yeah, yeah, yeah.
Ito naman, Doc, this is a question from Jen Peña. Doc, what's the difference between intravitreal injection of aflibercept and posterior vitrectomy po? Type 1 DDM po ako with diabetic retinopathy has already done PRP in both eyes last year.
Okay, I'm reading the question. Okay, yung intravitreal injection is of this drug is usually done either by itself or in conjunction with posterior vitrectomy.
Mhm,
So it's not real. You really cannot compare both. But maybe a more straightforward answer to this is usually yung posterior vitrectomy is done when the retinopathy is more severe, while yung intravitreal injection is performed in less severe types of retinopathy.
mhm,
Now, the question says type 1 IDDM po ako. So, as I said earlier, yung type 1 na diabetic patients usually have poorer control and have more serious uh, type stages and types of retinopathy.
I see. So I think that's the case for this particular patient. And based
Yeah.
sa sinabi niyo, Doc, parang when it comes to retinopathy management, you always do not like the more non-invasive procedures first. So it's either medication muna, and then you move on to injections before you
Yes.
even consider surgery. So meron siyang levels depende sa
Yes.
kondisyon ng mata.
Yes. She mentioned a while ago about PRP. Was this the same? Was this the same question?
Yes, Doc,
Yes.
same
P-
patient. So
Yeah.
nag-PRP na siya for both eyes last year.
Yeah. So PRP is another way you can control diabetic retinopathy. So the two basic treatment modalities are laser treatment or PRP and the injection of drugs into the eye. Yung vitrectomy, usually when you do that, kasama na doon yung laser and the injection.
I
You see.
see. Okay. Okay.
So you just do everything all together.
I see. So again, it depends on your condition. The more serious the condition is, the more likely doc na nagko-combine yung mga modalities that they
Yes,
need to undergo.
yes, the more chances that you will need all three types of treatment.
I see, I see. Okay. And then next question naman is from June Budit Dakiwas. Good afternoon, Doc. Gusto ko po magpa-check up kasi may floaters ang mata ko. Minsan, kumikirot. And pina-check ko na 4 times, dalawang ophthalmologist. Wala daw problema. Ano kaya ang magandang gawin ko, Doc? Okay.
Well, yung floaters, uh, hindi siya exclusively a symptom of a retina problem of diabetic retinopathy. I'm sorry. And most of the time, kung floaters lang, this is caused by the aging of the vitreous, no?
Mhm.
So sabi niya 4 times na siyang nakita and walang nakita. That's good news. That means na nag-age lang yung kanyang vitreous o yung tubig sa loob ng kanyang mata.
Okay. And then, Doc, itong part of yung complaint niya kasi is that parang kumikirot. Hmm. Yeah.
Yeah. Same, yung eye pain or kirot is not exclusively dahil sa diabetic retinopathy. In
Mm.
fact, most of the time, wala namang pain na nararamdaman yung patient. Unless andoon na sa
Mm.
stage that you mentioned earlier, yung neovascular glaucoma, no? Then
Mm.
maybe. But normally, wala naman.
I see. And actually, Doc, di ba minsan eye pain is associated also with stress, even fatigue sa mata. Kapag let's say magdamag kang nag-work on your computer, pag minsan there's a little bit of discomfort sa mata din.
Yes, yung kirot can be due to dry eyes or the pressure could be up or eye strain, computer vision syndrome, or lack of sleep lang can lead to those kinds of symptoms.
Mm-mm. Okay, so in that case, siguro baka it's a matter of also
That's right.
eliminating some of these other situations na baka nakaka-affect sa mata niya, no, Doc?
That's right. Yes. Oo.
And then, Doc, there's another question here. Pwede pa bang bumalik ang malinaw na paningin after ng treatment ko for diabetic retinopathy?
Depende sa stage eh. So kung nasa non-proliferative stage, usually na ibabalik pa sa dati or at least
Mhm.
na preserve. Yung more serious stages ng retinopathy, sometimes we're able to arrest yung deterioration, but we may not be able to bring back the vision to normal.
Okay. So I guess in that case, Doc, that's exactly why you have to get checked. And I think it's related also to the next question. So from Jean Moradillo, Doc, may pag-asa pa ba na magamot kung almost brown na lang ang nakikita ng right eye ko and the left one naman ay may floaters na?
Yung brown na nakikita niya, baka vitreous hemorrhage yan if she's diabetic, no?
Mhm.
So that's not a good sign. So kailangan siyang ma-check.
Yeah.
Again, floaters is not exclusively a symptom of diabetic retinopathy. So she has to be checked.
Okay. So yun
Yeah.
po ma'am, siguro that's a tip from doc. Let's get checked. Kasi alam natin naman na medyo nakakatakot na magpa-check up kapag may nararamdaman ka na or napapansin sa vision. Pero mas mabuti po talagang magpa-check up na para alam natin kung ano yung dahilan, kung bakit parang brown na yung nakikita ninyo. And then at least mako-confirm kung ano ba yung possible cause ng floaters. Kung related siya sa sinasabi ni doc na parang habang tumatanda tayo, nagbabago rin kasi yung tubig sa loob ng mata kaya nagkakaroon ng floaters. And then next question naman, doc, from Tenerife. I have diabetic retinopathy with macular edema and ililaser po ang mata ko. Does it really hurt?
Yes. Yung laser kasi is a burn, no?
Mhm.
You're doing a controlled burn ng retina. May parts kasi sa retina na malapit yung nerve doon. May
Ah,
malapit na nerve. So, pag nalilaser ng doctor yung areas near the nerve, mas may pain. So,
mhm,
depende what part of the retina. And usually, when we do laser sa diabetic retinopathy, we do what we call a PRP or pan-retinal photocoagulation. So,
mhm,
during the laser, there may be times na mas masakit compared to other times.
mm. Doc, matagal ba yung process nun? Let's say a patient needs to undergo the PRP. Uh, does it take long to get it done, yung procedure mismo?
It doesn't take long. Siguro mahaba na yung 10 minutes. But usually we don't try to complete the laser in one sitting. So we ask the patient to come back a second or a third time para hindi naman mabigla yung mata na napakaraming laser at one time.
I see. So at least ang ginagawa ng doctors typically is to make it more manageable. They schedule
Yeah.
it so that
Yes.
siguro psychologically, doc, alam mo kasi kailangan mo siyang pagawa. So if you know it's gonna be broken down into sessions,
Mhm.
nahahanda mo rin yung sarili mo for the discomfort or the pain that you might experience during the procedure.
And some patients are also more sensitive than others, no? So of course that makes a difference. And kapag may cataract, for example, that means yung
Mhm.
lens nagiging cloudy. Yung laser burn can vary in terms of yung intensity doon sa retina. So during the process, sometimes masakit, sometimes hindi.
Hmm,
So yung cataract can affect yung pain
okay.
uh,
Okay.
during the laser treatment.
Okay. So yun siguro. So yes, there is discomfort. There's a little pain kapag papa-laser. But
Mhm.
again, from the sound of it, it's something that still has to be done. So siguro, kailangan mo lang po talagang ihanda ang sarili mo for that kind of procedure. Ito
Yes.
naman, Doc. There's another question. Pwede bang magkaroon ng cataract ang taong may diabetic retinopathy?
Ah, yes, pwede magkaroon ng katarata. In fact, yung cataract yung cataract, especially early cataract, is associated with patients with diabetes. And the more serious yung diabetes, mas maaga at mas malala yung cataract formation.
Hmm. Okay, so in that case, doc, siguro a patient lalo na if maybe they have the type 2 diabetes, they find na although ang cataract typically mga 60 years old and above na develop, baka sa kanila they might get it at 50. So a little bit earlier talaga. Um, if a patient doc has both, let's say meron siyang catarata at meron siyang diabetic retinopathy, what do you have to treat first?
Mas serious yung diabetic retinopathy. So as much as possible, we try to treat and control the retinopathy first before we take care of the cataract.
Okay.
Pero sometimes, kung masyado na rin malala yung cataract, then we have to do both at the same time.
Pwede yun, doc, in
Pwede,
one
yes.
specific procedure.
Yes. Like, for
Okay.
example, you can do the cataract and the injection at the same time. Yung nabanggit kanina nung first patient natin, no, who asked about the injections. So that can be done.
Okay. Okay. So yun, that's interesting daw kasi I think a lot of people think na yung mga eye conditions na parang nakasilo sila. One does not have anything to do with the other. Pero in fact, they're related. They could be associated with each other. And pagdating mo sa doctor, doon natin na-determine kung ano yung dapat unahin or dapat kailangan bang pagsabayin.
That's right. Yes.
Mm-mm. Then,
Yes.
and then another question naman from Logic Cruz. Is it the same in damaged retina due to eye stroke at saka yung retinopathy?
Iba yon. Iba yung condition na sinasabi niyang stroke sa retina. Yung
Mhm,
stroke usually related sa hypertensive retinopathy
mhm.
more than diabetic retinopathy. But as I said earlier, you can have both, and one can contribute to the other.
Okay, so at least
So hindi
mag-check.
siya again, hindi siya exclusively sa diabetic eyes.
Okay, so posible Doc na, kapag nag-eye stroke ka dahil yun sa hypertensive retinopathy mo, but it also so happens na meron kang diabetic retinopathy.
That's
So
right.
okay, okay. So kailangan mong malaman talaga if you have one or the other or if you have both.
Yes, usually the fluorescein angiogram can help with the diagnosis and differentiate one from the other.
Okay. And then this question naman, Doc, we have a last question from Jen Kwan. Doc, if my vitreous hemorrhage, what is the management for that?
Pag vitreous hemorrhage, almost always they will need surgery, yung tinatawag na vitrectomy. Kasi when you have hemorrhage, how can you laser kung nakaharang yung dugo? And how can you
Mm,
assess the retina kung makakatulong ba yung injection if you don't see the retina? So, almost always we do surgery sa vitreous hemorrhage.
I see. Okay. So again, serious condition, Doc. Basta't na-diagnose ka nito, likely, Doc, immediate dapat yung surgery for that?
Yes, almost always it will end up in surgery.
Okay. Ay, okay, Doc. Actually, there's someone
Yeah.
who did a follow-up
Yes.
question. Ah, yung floaters sa dalawang mata ko ay parang may agyo at may brown spots, pero natutunaw naman ang kulay brown at yung parang agyo na lang yung natitira. Doc, 2020 naman yung vision ko. Mm.
Uh, yung pagiging 2020 ni June is not a guarantee na wala siyang problema sa retina or
Mhm.
diabetic retinopathy.
Okay.
Yung brown spots sa akin might be a sign of bleeding.
Mhm.
And again, hindi naman exclusive yung floaters and seeing brown spots or bleeding sa retinopathy. It can happen in other types of retina problems.
Okay. And then
So,
same ba yun, Doc, with the agyo, yung parang seeing cobwebs? Is that
yeah,
also a possible symptom?
actually, yung floaters and the agyo, I think he's referring to the same thing.
Okay.
Yung spider webs, yung floaters is usually described as parang spider webs, no?
Parang they're floating in your vision. Okay. So
That's right.
siguro yung mahalaga for June is kailangan niya mapa-check up para malaman natin kung actually may bleeding na sa kanyang mata. Kasi sayang naman kung nag enjoy siya ng 20/20 vision ngayon, pero kapag hindi natin nabantayan, baka maapektuhan, baka po tayo magkaroon ng vision loss or some sort of detachment. So yun ang mahalaga kung mapagawa natin.
Mm-hmm.
Okay, so Doc, that was our uh, is that our last? I think that's our last question. So, what Doc would you advise for our Facebook Live viewers, Taban, who are watching us? Okay. Okay, so I think we're having a little trouble getting Dr. Veloso back online. Pero just to recap about what we've discussed, na kapag diabetic retinopathy kasi ang na-experience natin, mahalaga talaga na nakakapagpa-check up tayo every 6 months. Alam ko parang madalas siyang pakinggan, pero when it comes kasi to blood sugar, dahil araw-araw tayong kumakain and we want to continue to have a good and comfortable life, ah, kailangan na talaga nating bantayan yung ganitong condition sa mata kasi may direkta siyang impluwensya at apekto sa quality of life natin. Kasi siyempre, ang ayaw nating mangyari is yung talagang papabayaan natin siya. So over time, aside from tumataas yung blood sugar natin, baka tumataas din yung blood pressure. Or let's say, or medyo matataba ang kinakain natin, so mataas rin ang cholesterol. So kapag kinumbine nyo kasi yung mga bagay na ganun, ang posibleng mangyari talaga is pwede siyang mauwi sa vision loss at permanent blindness. Kaya yun yung iniiwasan natin. So when it comes, and I think marami sa mga nagtanong sa atin today, meron ng na-experience na maybe certain eye conditions that have affected their vision. And one of the main things that Dr. Veloso always tells us is that syempre, wag na nating hintayin na medyo seryoso na yung nararamdaman natin. Mas mabuti pa rin na kapag meron kang naramdamang pagbabago, magpa-check up ka na agad. Kung sakaling sa pamilya nyo, meron naman talagang nagkaroon na ng diabetes or nabulag ng dahil sa diabetes o kaya na-amputate ng dahil sa diabetes, mga signs to na posibleng nasalahin ninyo ang pag-develop ng ganitong kondisyon kung kaya't mas mahalaga na nakapagpa-check up tayo ng regular. Ang siguro ang tatandaan natin na between ang prevention or yung mga check-up natin at saka yung pagpapatreat na natin, kailangan mo ng combination, sinasabi ni Doc, na injection, plus yung surgery, at saka yung mga gamot, mas mahal po yun eh. So, at saka mas naka-stress siguro siya para sa pasyente mismo at para sa mga nagmamahal sa kanya. So, mas mahalaga po talaga maipa-check up natin at mapagawa yung mga diagnostic test na kinakailangan para ma-monitor ng doktor kung ano talaga ang nangyayari sa loob ng inyong mata. Hindi kasi lahat ng bagay na nadadaan natin sa pagsusuot ng salamin or sa pagpapalit ng salamin dahil nagbabago yung ating grado. And now we're trying to get Dr. Veloso back online para he can give us a few additional tips and some what he can suggest for our Facebook Live viewers. Ayan. Hi, Doc. Hi, Doc.
Uh,
Uh,
Nawala ata ako. Yeah.
we're glad
Okay.
to have you back online.
Yeah.
Siguro, Doc, in general, a lot of the eye conditions na napag-usapan natin sound fairly serious. So if you were to give any advice to people who have diabetes or yung mga meron silang mahal sa buhay na merong diabetes, what would you recommend for them?
Well, first of all, they should find out kung meron ba silang family history of diabetes or sila mismo may diabetes. Kung meron, then they should see and see their eye doctor right away, preferably ang isang retina specialist, kahit na nakakakita pa sila mabuti. And have a uh, uh, complete eye exam.
Okay.
And they should do everything to control yung kanilang blood sugar by dieting, exercise, and
Mm-mm.
taking their medications regularly.
Okay. And then, Doc, if there are viewers with us today who are interested in getting their eyes checked with you, where can they schedule with you?
I think on the screen, andyan yung aking schedule
Mm.
and the numbers
Okay.
that they can contact.
Okay. So for
So,
those watching us, that's
yeah,
Monday, Tuesday, Thursday, and Saturday in Rockwell. And then on Fridays, Dr. Veloso is in Trinoma.
that's right. Yes.
And then, Doc, thank you so much, Doc, for spending your afternoon with us. We actually learned quite a lot from you. And I think in my case, I learned a lot about how diabetes kasi can really turn into other more serious conditions.
Yes, that's right.
And then we hope we can invite you again another time.
Anytime,
And
Audrey.
okay. And then thank you so much, Doc. Thank you for spending your afternoon with us.
Thank you also for having me.
Okay. So
Good
for
afternoon.
okay, good afternoon. And then for everyone else watching us today, we did talk about that we have a teleconsultation service. So for only 800, you can talk to your Asian eye doctor from the comforts of your home. Of course, kung gusto po natin na makamura ng konti, kapag pumunta po tayo sa www.asianeyeshop.com, meron tayong EGC doon. Kapag binili po ninyo yon, you can get the teleconsultation for half the price. So 400 pesos instead of 800 pesos for teleconsultation. Uh, and if you want to schedule that appointment, ang tatawagan lang po ay 8898-2020 o kaya 0917-800-9103. You can also get a new pair of eyeglasses or replenish your stock of medication through the asianeyeshop.com. Meron kaming friendly team of customer service reps and eye experts to assist you when making your purchase. So kapag pumunta tayo dun sa website, hindi lang kailangan na kayo mismo ang bumili kapag meron kayong mga katanungan. Meron tayong available na optometrist that can assist you every step of the way. We also have some ongoing promos. If you buy 5 Hayaback, you get 1 free Hayaback. If you buy 2 Blephagel, and you can get 1 Hayaback free. And of course, kung bibili tayo ng daily specs or kid specs frame, meron tayong free upgrade to UV plus blue light lenses. Mahalaga yan ngayon, lahat tayo kasi ay online. So, kailangan talaga natin ng UV and blue light protection kasi nakakatulong siya for digital eye strain and even for dry eyes. So you can also avail for other electronic GCs. So the first is yung Asian Eye Family Eye Care Package for only 5,840. It's good for a family of 4 na. So kadalasan kasi, nakakapagpa-check up tayo ng mga anak natin pero nakakalimutan natin that we also need to check up for ourselves as parents. So it's good, take advantage of the GC so that you can do it as a family. And then, of course, we have the LASIK Buddy Package where you can get 2 LASIK screenings for only 3,900 pesos. So, dalawa na kayo, you can undergo the screening process together, and you might be able to get the surgery done as well. And it's good to remember that we actually have a running promo where you can get up to 30% discount on your LASIK surgery to book your screening. Kapag pinag-iisipan niyo na po talaga ang LASIK, it's a good time to get it done. Remember that you can get the EGC from our website, asianeyeshop.com, and that we ship nationwide for your medication, for your glasses, or even for your accessories that you might need online. And free delivery siya for purchases of over 1,700 pesos. Okay. So again, thank you so much for joining us today. Please remember that we're actually celebrating our 20th anniversary in Asian Eye. So we're offering 20% or more on selected surgeries. For more information, send us a private message or call us via 8898-2020. As always, it's been a pleasure spending this afternoon with you. We hope you learned a lot from Dr. Veloso and you keep taking care of your eyes. Please continue to be safe even though we're on alert level 2. I know we're excited to see our friends and family, but it's important for us to also keep ourselves safe because we want to be able to spend a happy and healthy Christmas and New Year season. So again, this has been Audrey, and I'll see you next time.